Hi, I'm Brian Finestein. I'm the CEO of Saint Clares Health. I'm here with Jen Neglia. She's the director of our Rehab and Sports Medicine department, and we're here to Let's Talk Health. So right now, we've been going through the surge with COVID, and Jen has seen patients who require post-COVID a number of services that we do provide here at Saint Clares. So Jen, do you want to give us a brief overview of what you're seeing and perhaps some of the services that you're seeing we need to provide?
Absolutely. So I want to thank you for the opportunity. My team and I started seeing post-COVID patients back in the spring, early summer. We didn't realize what was happening at the time, but they came to be known as post-COVID recovering patients. These patients were being referred to us by their physicians for a variety of things. The more common ones were muscle weakness, muscle atrophy, which is muscle wasting, very low endurance. They were losing their oxygen levels because a lot of COVID patients monitor with their fingertip monitors. We were finding people were losing balance and falling. There were things like memory loss, cognitive impairment, and there were even issues with speech and swallowing. So before we knew it, we were seeing a post-COVID recovery group of patients, and that's where our service line began.
Okay. So Jen, for those patients who require physical therapy, what type of services are you prepared to provide?
We do a full assessment, and many of these include a physical performance test. We provide a lot of stretching, strengthening, and endurance activities to help people build up their stamina. And while we're doing these programs, we're translating it into regular function. So we will ask them what are some of those things that they're having trouble doing at home. We do continue to monitor vital signs, and we teach them how to do a lot of these things at home so it becomes a part of their home exercise program.
So Jen, you mentioned that we offer a number of physical therapy services. Could you go into a little bit more detail in terms of the types of therapy?
Absolutely. So once we've done our evaluation, we're able to use a lot of the equipment that we have in the gym. So we have cable and free weights for strengthening. We're doing a lot of stretching with these patients on our mats. And of course, there is a lot of the cardio equipment. So the treadmills, the upper body ergometers, which is the arm bike that people use. And then we have a variety of bicycles, whether it's a recumbent bike or an upright bike. We have these patients in the parallel bars as well, using our different balance equipment, because there is definitely a lot of balance loss with the patients that have been hospitalized for a period of time.
Okay. You also mentioned that swallowing has been affected. So talk to me about what we can do from our speech therapy department.
For those patients who were hospitalized in the ICU, especially those that were on the ventilators for prolonged periods of time, we're finding that their muscles have weakened, making it difficult for them both to chew and swallow. But when you look at those muscles and you look at what has happened to their lungs, they're also having a problem called aphonation, which means they're having trouble taking enough of a breath to then speak out loud and enunciate. So our speech pathologists are working with the swallowing patients as well as those patients who are having trouble with speech.
Okay. You know, in the course of events, how long is that therapy run typically?
So typically we're seeing a patient 2 to 3 times a week for about 8 weeks, and then we do a reassessment. If it seems like we've achieved goals and the patient is ready to continue to monitor and do the program on their own, we're able to discharge. We have had a few patients stay on program for upwards of maybe 3 months, but those are the ones that were in the intensive care unit for an extended period of time, and they have what's known as post-intensive care syndrome. So you take that plus the COVID, and there's a lot of recovery that has to happen. Those patients tend to be the multidisciplinary patients, which means we're seeing them for PT and speech or occupational therapy and speech. And because we have all these disciplines in our Dover and Denville clinics, we're able to make the appointments for these patients back to back because they don't have the energy as it is. So they appreciate coming for an hour, hour and a half, and getting everything they need.
Okay. You also mentioned about memory loss. I don't know that many people in the community realize that's also one of the side effects, if you will, from COVID. Exactly. Can you talk to us about that, and also what can we do?
So, when you've been in the hospital for a long period of time, especially in an intensive care unit or a progressive care unit, you do spend a lot of time alone. You spend a lot of time with all of the different alarms and monitors going on. And then you exacerbate this with some oxygen loss from COVID. And you do start to see people with what they're calling fog, like a memory fog. They're having trouble with short-term recall, difficulty balancing a checkbook, problems sitting still and attending to task. So either the speech pathologists or the occupational therapists have a series of exercises and activities that they can do with these patients to help sharpen their memory, their attention, and their cognition. It's almost like a patient who has had a stroke. And we have seen a lot of patients have strokes as a result of COVID-19. So in addition to the symptoms of COVID, we're not only seeing patients that have had strokes, there are patients with chronic illnesses that had those symptoms exacerbated, such as multiple sclerosis or Parkinson's. So it's a multi-symptom effect that the COVID has had on the patients, and we're able to address all of those things.
Right. Now, however, so we've been focusing heretofore on the COVID patients. Can you get this same type of therapy just because you have those same types of conditions, even though they're not COVID?
Absolutely. So we offer the full service line for everything from orthopedic to the neurologic. We have a very active Parkinson's program and other neurologic issues such as multiple sclerosis. But as I had said, we do find that people with COVID who were in the hospital for prolonged periods of time tend to have other comorbidities, as we call them. And those are the things that are exacerbated, and when they go home from the hospital, or those that recover at home, are finding those symptoms are now getting in the way of their daily function. So we're able to help them with all of those things as well, whether it's COVID or patients who were avoiding coming out and didn't get to go to their doctors.
So I'm sure, our listeners are seeing, gee, we have or have a family member who have some of these symptoms and they want to get taken a look at, treated perhaps. How do they contact you?
So we're fortunate we have our own patient access team in both the Dover and the Denville campus. So we do have phone numbers that go directly to those registrars. They assist with the financial counseling. They do everything that's needed to help get set up with the insurance, and then we're able to get the appointment right away. Okay. We're able to actually do same day.
You've covered a fair amount of ground. Jen, is there anything that we've missed so that our listeners have a better understanding of what we can provide for them in this post-COVID environment?
So there is. I think one of the advantages that we have in our outpatient clinics is that a lot of our therapists also worked with the inpatients. So we're very familiar with the multi-symptoms that are involved with these patients. When they're here with us for the outpatient PT, OT, and speech, we're very much aware of the other services that these patients might need. We're able to speak to their physicians and talk about cardiac rehab, pulmonary rehab. We have a patient currently going for a pulmonary functions test because we realized that their oxygenation just wasn't improving. So we needed more diagnostics. So there's so much that we have to offer, including social services. And we've made a few referrals to one of our social workers who has been working with the post-COVID population.
So you've been at this now several months, actually probably since the spring when we went through the pandemic and now again going through the surge. What type of age groups are you seeing?
So we were surprised. We are actually seeing people in their 20s right on through to the 70s, 80s, and 90s. It's running the gamut.
Okay.
It's running the gamut.
Thanks, Jen. So, listeners, this is Let's Talk Health, and we're very fortunate that we had our Director of Rehab and Sports Medicine, Jen Neglia. We are here for you for, again, post-COVID recovery. Jen has given us a good summary and outline of the services that we can provide. So we thank you for watching this segment of Let's Talk Health. For those who have other questions, please feel free to go on our website, www.stclares.com, to answer any other questions and for also future Let's Talk Health segments.